Hello, good afternoon, and welcome to another edition of Influence Stories, where we talk about great things that are going on in the community and talk to some very interesting people that are right here in our community. And today we are very, very fortunate to have with us our Dr. Audrey Ofir. She has a lot of titles that are all amazing and very impressive. Director of Pediatric Comprehensive Care Clinic. This is at University of Miami. Is that correct?
Correct.
Also, we have Director of Pediatric Residency Continuity Clinic and at Jackson Memorial. Is that correct?
Correct.
What am I missing? Tell us a little bit about what you do and your work, because that I find fascinating.
Well, first of all, thank you so much for having me here tonight. I actually am originally from France, and I came to Miami with my parents to do my undergrad at the University of Miami. I was very lucky to do my pediatric training right here at Jackson Memorial Hospital, and I decided to stay on board as faculty because I wanted to stay in an academic center. And so I not only see my panel of patients, which is composed of a fair amount of complex children, transplant patient, cerebral palsy, ex-premature, but also children born with severe anomalies. I also supervise residents in training during their training here at Jackson Memorial Hospital. And I also teach medical students during their third-year rotation in pediatrics at the University of Miami.
That's, like I said, very impressive, and we're very, very honored that you were able to talk with us today. We have many questions given your specialty. We have parents that are looking at summer, that are looking at the beginning of the school year, and are perhaps a bit concerned about the situation. We've seen a surge in cases, and you know, we know that if one thing I think we can say today is that COVID is not over. Is that correct?
Absolutely. And I think because this COVID crisis is prolonging itself, parents are finding themselves having to make really tough decisions for their children. And as you mentioned, summer camp is one of them. I think that the problem is that whenever you want to make a decision, you want to outweigh the benefits and the risks. We do know that summer camps have definitely positive effects on children. So it gives them certain skills, a certain level of independence, leadership skills. It also gives them bonds. It creates bonds with other children of their age. The big problem being that right now with COVID, parents have to be able to gauge and make sure that this camp experience is going to be able to be a safe one for their children.
Yes, I think that all of those things, I'm a mother myself, I have very young children, and summer camp was always something that I personally looked forward to because they always have fun and they enjoy themselves, but the way that kids interact is not the same the way that, some parents or adults interact. Kids are very close. They sometimes share food. They share, bottles of water. They hug a lot. So tell us a little bit more about, I know that we have some people that are listening right now, I can see them, that are concerned about, how do they look? For example, we have a question right now from Lisette. What do I look for in a camp? What safety precautions? Can you talk a little bit more about what some of these summer camps could do to keep things safe for our children? Because there are also some parents that must put their children in summer camps. Sometimes these are not optional for a lot of working parents, such as frontline workers and healthcare workers, such as yourself, for example.
Absolutely. So it's been tough because there haven't been really national guidelines put out there for summer camps to reopen during COVID. But the CDC has put out kind of a gauging scale to be able to tell how badly or how risky the summer camp is for your children. And this gauging scale is based on a couple of parameters or factors that parents really should look at, or at least pose the question to the summer camp staff. So a couple of them are, first of all, is the camp going to be enrolling a large group of campers or a small group? Knowing that the smaller the group of campers, the safer. Are these children going to be from the same geographical area, from your same neighborhood, or not? Knowing that if they do come from your geographical area, it is safer. Is that group going to be the same group along the summer? So a constant group, same with the counselors, because that we know that it is safer. The other thing also is it going to be outdoor activities or indoor activities? Knowing that outdoor activities definitely are safer than the indoor activities. And then you want to ask, are you going to make sure that the children are not going to share any objects during the activities? That's an important question. You want to ask the camp, well, what kind of COVID measures are you taking for sanitizing the place, for example? Are they going to sanitize the tables, the chairs, the doorknobs, the ramps throughout the camp and after activities? Are they going to have sanitizing stations throughout the camp with the counselors perhaps reminding the campers to wash their hands frequently throughout the day? Another important question will be mealtime, because of course you cannot wear a mask when you eat, so you are at risk to contaminate yourself. So you want to ask the camp ahead of time, what is their policy for mealtime? Is it going to be outdoor, perhaps, where it's less risky with social distancing, where it might be a little bit safer for the child to remove the mask and eat at that time? You want to ask that question ahead of time. Another question that perhaps parents might not think of asking is, does the camp have an action plan for if somebody gets sick in the middle of the day? So whether it's a camper or it's a counselor, if they get sick with fever or a cough in the middle of the day, what is the protocol in place? So hopefully they have a designated person who will come and isolate the sick person right away, will evaluate the person to see how urgent the care is or needs to be. If it's a camper, they will need to get in touch with the parent right away. So you want to make sure that the camp has a plan of action, has a protocol in place. A lot of question, a lot of homework, but it's necessary if you want to make sure that the camp will be a safer place for your child.
Yes, absolutely. Those are a lot of things I had never thought of, to be honest. I mean, for example, let's talk about outdoor activities. Why are outdoor activities safer?
Because you can offer social distancing a lot better. If you are in an enclosed place, it is harder. So, for example, the CDC has mentioned 10 people in an enclosed place is safer than, let's say, 20, 50, or 100 people. But really, that number alone doesn't mean anything, because if you have a room that's a closet space, well, 10 people really doesn't do the trick, because you cannot keep the social distancing. Whereas outdoor, so let's say a park or a beach, so you can distance the people apart and respect the social distancing outdoor better.
Ah, I see. So it doesn't really have anything to do with just like actual, people talk about the particles, right? The particles of COVID that move through the air. Talk to me a little bit about, is there a difference between indoor and outdoor for these particles that are in the air?
So you have to remember that those particles will remain in the air only for a limited amount of time and then will drop. So whether you're going to be indoor or outdoor, they will still be, and the social distancing is important. Now, Of course, if you're going to be in an enclosed space without the windows opening or any ventilation of any kind, yes, then it becomes important, of course, because you're going to soon enough be breathing the air of somebody else, especially if that other person doesn't have a mask and so on and so forth. So yes, there is a difference. But again, those droplets, let's say you don't have a mask, you don't have social distancing, will come across and then at some point soon enough will drop.
And then, today, actually, there's a question about the heat. It's very hot outside today. There was actually a heat warning for South Florida, to stay hydrated, to stay safe. So is this something also, I mean, this is like kind of an added thing that we have to think about in South Florida. While the rest of the country is waiting for summer, we are waiting for winter. It's very hot here. So how can parents balance that?
So yes, it has an effect on the virus in the sense that the virus does not like heat, the COVID virus. However, I think we have to be careful. We don't want to give a false sense of security and think that Miami is perhaps protected compared to other cities or Florida to other states, because we still have to very much respect the social distancing, wear our masks, wash our hands, for example, even if it's hot outside. So yes, the COVID virus does not like the heat, but do we have to be more liberal about our precautions? Absolutely not.
So you mentioned the masks. So these kids should be wearing masks throughout their summer camp. It's very difficult to get kids to wear masks, especially the very, very young ones, and throughout the entire day. I mean, how do we work with that?
So it's an excellent question. We know from the studies that the mask is definitely protective. It's protective to the individuals around you, actually up to 90%. Even for a person who is COVID positive, it is protective to the other people around them up to 90%. For a person who's wearing a mask, and I'm talking about wearing it appropriately, covering the nose, covering the mouth.
Right, everything, not with the nose out, which I see a lot of, or on your chin.
That's important. That's important to note. So if a person is wearing their mask appropriately, they themselves will be protected up to 30%. Now, it may seem like a low number, but if you combine it with social distancing and washing your hands frequently, you can definitely boost that number up significantly. Now, for children in particular, yes, it is difficult to have them wear a mask, and it's a new behavior. And like any new behavior, it's not easy to teach children. So we pediatricians like to use behavioral modification, and I usually say it in 3 steps. You prepare them, you practice, and you reward them. So in order to prepare them, first thing and foremost, you want to talk to them. At their age level, with their own vocabulary, you want to explain to them why it's important for them to wear the mask, to make them safer and to make the other people around them safer. You want to engage them with the whole making of the mask, as far as coloring it, perhaps. You want to perhaps put the mask on their favorite doll or favorite stuffed animal. You maybe want to do role play. So you put the mask on and you're a superhero with a mask. You want to also be a role model. So when you're going to be practicing, because that's the second step, and you want to start doing it at home before you take them outside with a mask. So you want to practice, and practice again, and you want to be a good role model for your child. So you want to wear your mask as well and put that mask on them, but first at a very limited amount of time, and then progressively just lengthen that time until they get used to it. If they get frustrated, listen to them, let them vent. And then progressively, you want to go ahead and put that mask on longer and longer until they're ready to go outside with their mask. And then you reward them. So you want to go ahead and give them stickers or reward play. That's behavioral modification. It works with a lot of new behavior. It works very well. Pediatricians like it. So prepare, practice, and reward.
That's great. We have a lot of questions coming in. about what kind of masks are the best ones to use. If you could share that with us.
Sure.
There's so many masks out there now. It's
Right.
like a whole cottage industry.
So either the cloth mask when you're going outside or the regular surgical mask will do actually. The N95 really are for healthcare workers, essentially. It is important to know, and I think you kind of alluded to that earlier, and I didn't mention it in my answer, but the rule to when to wear a mask is very simple. You want to wear the mask and put it on your children at all times when you're outside your house. So always wear it
all times, always.
All times. If you want to make it safe, wear it all times. There are only two exceptions to that rule. If the child is less than 2 years old, you do not want to put a mask on a child less than 2 years old because it will be difficult for them to breathe through. The second exception is if the individual has any underlying condition that will make them hard to breathe through the mask. Again, do not put a mask on them. It is important to breathe first, right? And then protect yourself and protect others. So wear the mask at all times, except if it's a child less than 2 years old or a person who has an underlying condition that makes it difficult for them to wear the mask.
We have other questions coming in. For example, what are best practices for children eating in groups? We talked about this a little bit before, but maybe just kind of answer that question again since it just came in. When they're eating in groups, say they're outside, kind of distance, they have to remove the mask. They can't eat with the mask on.
So outdoor better than indoor. Social distancing is a must. You're going to have to put your mask down and make sure that they're not sharing any utensils or any objects during that meal time. So if there's going to be a serving, for example, you don't want them to touch that spoon and then the next child is touching that spoon.
Oh.
Things like that we may not think about pre-COVID. We have to think about now. So maybe ask the camp or think about before going out to an activity, you want to give them their meal, their lunch to themselves so that there's really mitigation of risk and you don't want them to touch anything that another child will have to touch or another individual.
Okay, interesting. So one person maybe should serve everyone and wash your hands.
Correct.
Wash your hands.
Yes,
so
again.
We've talked about going outside. There are a couple more questions. Parks. Is it safe to go to a park? Playgrounds are closed for the most part, at least in Miami-Dade County. Parks, some parks are open, but playgrounds are still closed, much to my daughter's dismay. But it's for their safety, and I keep telling them that. So tell us a little bit about why some parks are open, some playgrounds are closed, but also people are asking, well, my kids ride bike, they ride skateboards, they're not going to be wearing this mask because they're exercising, they're sweating. Is social distance at the park enough while they're doing these exercises?
So anytime you're going to consider an activity, there are a couple of parameters that you want to look at to gauge the risk of the activity. Is it going to be outdoor or indoor? Again, outdoor is safer. How many people are you going to have around you? Knowing that the fewer people, the safer. Are you going to be able to respect social distancing? So is it going to be a small place or a larger place? Is there going to be allowed a social distancing? We can talk about zoos, for example, and other places where activities can be done with children. And then is there going to be any sharing of objects or contact surface areas? So that's what playground is a higher risk because you have contact surfaces that the children don't know any better, so they're going to be touching it. You don't know whether these children are carrying the viruses. There are adults with those children that you don't know their behavior during the crisis. There's no way to sanitize that playground enough or well enough for your child to be safe. So the playground in itself has too much traffic, too much unknown, too much contact surface area, not enough social distancing. So definitely on the gradient, too much risk for the playground. In the park, in the country, it's outdoor, you certainly can respect social distancing, and you want to minimize the surface contact areas. So the bike, well, I would say if the bike is going to be to the point where they're not going to be able to wear the mask, then make sure that there's nobody around you, very, very far away, and then it's going to be okay. It's outdoor, nobody's around you, you're with your family unit. I would say it's okay. Yes, because
So
make sure that the child, I'm sorry, you want to make sure that the child is breathing fine, through the mask. So if they're exerting themselves, you don't want them to go into, breathing difficulties. So you want to allow them to remove the mask, but make sure nobody's around.
So social distancing in those situations are it's very, very important. If you can't wear a mask, they're working out, they're doing exercise, all those different things. So we have other questions that come in. We need to get the children outside to run. What kind of public activities are safe? I think we kind of covered that, talking about social distancing. What about, it is summertime, beach, pools? What do we prefer? The beaches are open. We all saw these pictures of them being jam-packed, but for the most part, I've seen that people have been respecting their space, and you sit with your little pod. So what about the beach, the pool? Is the pool safe? Sharing a pool has chlorine. We think it kills everything. What are we talking about?
So again, the beach is considered a lower risk activity. It's outdoor. You want to be able to keep social distancing. So you want to make sure that you're going to go to a beach that is not crowded, obviously. You want to make sure to have the conversation with your child before leaving to the beach to make sure that they understand that they have to keep social distancing, that they have to stay with you, not run around and go play with somebody else. It's important to have that discussion. You want to bring your mask with you just in case, because if you start seeing people coming to the beach, then you want to start wearing your mask. As far as I'm concerned, if it starts to get crowded, you'll go home. But the beach essentially is a less risky activity right now because of all these reasons. The pool, less safe activity. Why? Whether it's a public pool or a condo pool, there's a lot more unknown. There's more traffic, first of all. There's a lot more surface contact areas. So you get in with the gate, for example, the door, there's the ramp to get into the water. There are the chairs, there are the tables. You may want to use their towels. You're not sure how they sanitized it. And you don't know much about the people who have been in the pool. Are they going to really keep that social distancing with you? So the pool, not so much as far as safety. So if you look at the gradient or the range, beach, a bit safer, yes. The pool, not so much. I want to mention, if you're going to go to the beach or go to the pool, be very careful not to get the mask wet, because once it gets wet, it gets harder to breathe through. So you want to discard that mask and use another one, a fresh one.
That's very important. I mean, you're at the beach and you're getting in the water. You can't really wear a mask while you're there. Right. And like we said, kids like to play with each other. So maybe that it's very difficult to keep social distancing. We have a question here about how to ask respectfully for other people to wear masks, when their kids are interacting. Do you have any tips about that? Because you had some great tips about how to get kids to wear masks, which I will try. And the reward chart works great in my home. So we will try that for sure. So at any age, agreed. Everybody wants to get a reward. So for example, what can we tell people? Please, wear a mask.
So is this like a play date kind of situation, or this is a
question that came up? I think you can use, what are some respectful methods staff can use to reinforce mask wearing if children or their parents don't want to wear a mask or social distance and can't be kept from participating and engaging with children who are using safe practices? So I would imagine this could be at a summer camp or maybe, some sort of a public place.
I think that's an excellent question. And just the same way that we initially talked about the parents doing their homework by asking all these questions to the camp, I think that vice versa. The camp has to be very transparent about the measures that they are taking for COVID precautions, and what they are implementing to put everybody in a safe place. And so I think that signs, as far as out there throughout the camp, make sure that you wear your mask 100% of the time, and just the same way as the sanitizing station and all of that. I think that just a gentle reminder, from the staff should be taken respectfully. And just, what I deal with this in my clinic, for example, and just, when I come with my mask on, which is, by the way, not kids friendly at all. This is not our usual, outfit for a pediatrician. I usually just introduce the whole thing to my families as, this is a way to make you safer. Because I want to protect you and protect your child. So I think that it can be mentioned that way by the staff, as in, we believe in making you and your child safer. So would you please make sure to wear your mask 100% of the time around when you're in camp.
So make it about their safety.
Absolutely.
I think that's a great way of doing it. I agree. Yeah. What about, it's, people, even though we haven't really had school for months, kids are actually off. They don't even have the Zoom meetings anymore or the online classes. So maybe trying to travel. How do you recommend traveling? Hotels, Airbnbs, car, airplane, train. So what would you recommend?
Right. So it is a really important question. It's a difficult question. It's kind of a case by case. But again, you want to go ahead and gauge the benefits and risks, if you will. First and foremost, what I would recommend to the families who would like to travel is to look up on the CDC or Center of Disease Control, the location, the destination, and make sure that it is not a hotspot or a high risk for COVID right now. That's the first thing I would do. Because if it is an area that is risky for COVID, then it's a moot point. We don't need to talk about how to get there. So if it is a destination that is not a hotspot, let's say, then let's try to see how to get there. So you have an airplane, you have a car, you have maybe even a train. So with the plane, it's an enclosed space, so that's difficult. How to keep social distancing. Airlines have tried their best, but it is kind of limited in what they can do. Social distancing is difficult. You have a recycling of the air, but of course they have filter. But you have a lot of contact surface areas. You are at their mercy as far as sanitizing, so that is a problem. The length of time that you're going to be spending in the plane is also an issue. But what I want people to remember is also, it's not just on the plane, is also in the airport. You're going to be inside in the airport with a lot of people. When you're going to be in that security line, it's going to be very difficult to keep social distancing. You're going to be touching things that are not necessarily sanitized every single time that a person goes through. So these are really important factors to keep in mind when you want to go travel and you want to consider a plane. So if you don't really have to take a plane, perhaps not yet. The car, I mean, we think about the car. If you're going to take your own car, rental companies have been really putting their measures out there and they're sanitizing the car. But let's say you take your own car. So it's relatively safe. You would think you're going to do it with your own family members. So again, should be safe. The problem with the car is not so much the car itself, but the stops. Yes. So you have to think about, well, I'm going to have to make that many stops. What you're going to do with the stops, you're going to have to go to the restroom. You're going to have to eat. You may have an overnight stop. So that's what you have to consider. And then you have the train. So maybe that's an alternative. If you're going to have your own cart, your own wagon, it's a private one. If it's going to be sanitized, if you're going to be able to sanitize it yourself, you bring your own food. It's a short, limited amount of time. That may be an alternative. But again, always gauge along the factors that we talked about, the length of time, how many people, sanitizing, social distancing, and all of that. You put it in the balance, and that's how you choose.
And like you said, maybe, if you're going to drive, you choose to eat outside, maybe in either in your own chairs that you could bring or in a picnic table. There are some stops at picnic table, you could wipe it down. And then, the bathroom, then you do your best. Maybe try to make sure that you wash your hands and put hand sanitizer, and that you carry the kids in, because kids like to touch everything.
Exactly.
Yes,
The
and that's
idea
very.
is that, I'm sorry. Yeah, the idea is that now parents have to think of so many more questions and answers that we've never had to before. So the important thing is to think ahead, and ask ourselves all these questions.
So we've actually, we've been on for 30 minutes. I just have one question. This has all been amazing. I think that a lot of people will watch us over and over again. We definitely want to know, what about back to school? What are some of the things parents need to keep in mind? I mean, right now, nobody has actually said how we're returning to school, that I know of. So what are some of the recommendations you could give parents as we return back to school? So we look at going back to school.
So again, parents will have to do their homework. It's still a little bit early. The Florida Surgeon General, the Department of Health, the Department of Education are working very, very hard on this. We actually have a number of our faculty members who are on the committees. But I think that the different factors that the parents will have to think ahead will be how many children will be in the classroom at one time, what sanitizing measures will be taken. Will there be nursing on site to be able to take action when somebody is sick? What will be the protocol when somebody gets sick? What about testing, for example? Will there be maybe a hybrid of a group of the children in the class will be virtual schooling, while some of them will be in class, and then kind of swap and alternate? So all of this will be a list of things that I think parents will have to think about. I think that in the next couple of weeks, probably the Department of Health and Department of Education will come out with some recommendation and some guidelines. So more to tune in, I think.
Yes, I've seen more questions that came in that are asking, so does the pool chlorine kill the virus? We addressed pools, maybe choose the beach over the pool.
I'm sorry. I think that we shouldn't stop at just one thing. It's not all about chlorine. It just doesn't do the trick by itself. Because again, there's a lot of surface contact areas, there is traffic, there's social distancing. So the whole package is higher in risk than the beach. That's the problem.
Exactly. So that's exactly right. So it's about the whole package. And I definitely think that we want to just end this with the fact that we're talking about reopening, right? But we've seen a surge of cases in the past week here in South Florida, unfortunately. What recommendation do you have for people to stop this growth of cases? What can we do every day to help this?
I think that unfortunately we have seen the number increase. We were at less than 1,000 new COVID cases per day in the month of May in Florida. And just yesterday, as per the Department of Health dashboard that anybody can access online, we're over 5,000 cases, new cases of COVID in Florida per day. And that is a tremendous increase. I mean, the medical community down here certainly expected that increase, and both the University of Miami and Jackson Health Services were prepared for that. We definitely stocked up on PPEs and testing reagent. We have the bed facility for admission, but I think that the hope is that people will realize that this is absolutely not the time to be more liberal about COVID precautions. We would like people to realize that we and our loved ones need to remain safe, to be very strict about our social distancing, about wearing our masks at all times, and wash our hands frequently all day long.
Very important, okay? So not the time to be relaxed about this. Wash your hands, wear your mask properly, and keep social distance. I am a huge fan of University of Miami hospital services and Jackson Health Services. So I really appreciate you joining us today. I'm going to share some of the links that you mentioned during your interview. We're gonna share them. If people have more questions, please ask them in the comments, and we will try to get them answered later. Dr. Ofir, I would love to have you back when and if school returns, and whichever manner that is, so that we can educate parents about how to keep their kids safe and still have them have an experience in school or in summer camp. Such as you said, there's so many positive things about socializing for our kids. So that is basically, I would love to have you back. If there's anything else you would like to add to this conversation.
With pleasure. Be safe, stay healthy.
Okay. Thank you to everyone that joined us. Thank you everyone for your great questions and for your comments. And we'll see you back in Influence Stories next Thursday at 5 o'clock. Thank you so much, Doctor.
Bye-bye.
Thank you.